Is BCC really benign? Many patients tell me they've been reassured with phrases like BCC, that's a good skin cancer, isn't it? Or BCCs, they are just benign skin cancers. Let me clarify the language around basal cell carcinoma, BCC for short, and why the words we use can minimize how seriously it is taken, even though it is still something that requires treatment. Because they have been reassured in the past with words like benign or good, they feel confused when I say it still needs proper treatment. So, why do we as doctors use the word benign and good to describe this skin cancer type? Let's begin here. The word benign in medicine means non malignant, that is, non cancerous. It means a growth does not invade surrounding tissue. By definition, basal cell carcinoma is not benign, it is a malignant skin cancer. But compared with melanoma or aggressive squamous cell carcinoma, BCC behaves in a slower, more localized way. It almost always stays where it starts. So, why does BCC often get watered down? BCC is usually low risk for distant spread, slow growing, and death from BCC is rare. So, in that sense, it is a good cancer. It rarely spreads to distant parts of the body, but it does grow locally. It invades tissue, it destroys structures, it can recur, and it becomes a bigger problem if ignored. The key is understanding the difference between low metastatic risk and real local impact. They are not the same thing. When BCC invades locally, it can damage surrounding skin, cartilage, or bone if neglected. On the face, it can become disfiguring. It can recur if not fully removed. So while it is often not life-threatening, it is not innocent. Why then do people hear the word benign or good? Often it is reassurance language. Doctors are trying to reduce fear. In a country like Australia here, where BCC is extremely common, it becomes normalized. Compared with other cancers, it feels less dramatic. But words matter. When we call something benign, patients may delay treatment or underestimate the need for proper margins and follow-up. BCC is a malignant skin cancer, but with very low metastatic potential, but real local destructive capacity. It deserves treatment, but it does not deserve panic. This is about clear, proper understanding, not alarm. If you have been told your BCC is benign, the more precise message is this. It is low risk for spread, but it still needs appropriate management. And when we use the right words, patients understand the balance better.